I'm here today to speak about remote patient monitoring and how contact call centers can help with monitoring patients. So, quick outline, we're going to talk about what is remote patient monitoring, then why do we need that? What are the benefits to both the patients as well as financially, providers, and everyone else that's involved, as well as how does it work and how does a call center get involved in remote patient monitoring to help providers and health centers. So what is remote patient monitoring? It is a system where electronic device gets added to the patient. So it doesn't necessarily have to be a watch, but it's a device the patient wears regularly and that gathers information that then is transmitted from the patient to this new device, is transmitted, and then the information goes to the doctor's office. The doctors receive regular updates, which then give better health outcomes to patients. Now, why does it matter? Chronic disease has been a staggering cost to the healthcare system. It is one of the leading causes of death and disability in the United States, as well as high cost. It's responsible for over 3/4 of the expenditures on our $3.5 trillion in annual healthcare cost for the United States. About 6 in 10 adults in the U.S. suffer from some form of chronic disease or another. In addition, 4 in 10 adults have 2 or more chronic diseases. There are several different kinds of chronic diseases out there. The most common ones are patients with diabetes, obesity, and heart disease. But that's not even including those who have multiple medical conditions. To give you a sense of the cost, diabetes costs about $3.27 billion. That is $1 out of every $4 that we spend annually on healthcare costs. Heart disease and stroke cost about $199 billion, that is 60 cents for every $4, and obesity costs $147 billion, or close to 45 cents for every $4. So together, these diseases account for about half of all the money that we spend on healthcare in the United States. Furthermore, multiple chronic conditions, when they're added to these, account for about $2.3 trillion in healthcare expenses annually. There's a lot of benefits to remote patient monitoring. First, from the point of view of the patient, there's increased safety and convenience for the patient. The doctors receive vitals regularly, which means that they're able to regularly assess how the person is doing without the individual having to go to the doctor's office. It also increases compliance. When a patient has to put on a device regularly, they are being reminded about their chronic disease, and that encourages them to not only measure themselves regularly, but also comply by using the medication that they need, as well as engaging healthier habits that will help decrease their negative events from their chronic disease. And overall, there's also an improvement in health outcomes. And the reason for that is not only the first 2 reasons I just gave, but also because there are trends that doctors are able to receive, and those trends allow them to look at that information and intervene early before the patient even presents the symptoms. Let me give you an example of remote patient monitoring. I'm going to talk about congestive heart failure. Congestive heart failure is a case when a patient's heart are not healthy enough to pump the blood, and as a result, they can start collecting fluid in their lungs and other parts of their body. If a patient goes to the doctor's office and they suspect that there's fluid collecting, they're going to perform multiple tests, including this 4. 1, echocardiogram, which is an ultrasound that looks at the pumping of the heart and can be used to measure how effective the heart is pumping. An EKG that looks at the electrical activity of the heart, which is another way to measure how well the heart is pumping. They may also look at oxygen saturation. And oxygen saturation, or pulse ox, measures how well the patient is oxygenating their blood. And finally, a physician may also look at X-ray to look for fluids on the patient's lung. However, without a device that can monitor these or other measurements of the lungs and the fluid, how does a cardiologist measure when a patient is at home with no device? Well, I spoke to several cardiologists, and the answer I got was they used an easy-to-read analog scale. That's right. They were asking their patients to measure their weight, and if their weight went above a certain percentage, that is increased by a certain percentage in a short period of time, then they asked the patient to go see the doctor. Now, how effective do you think that is? Not very much, of course. How does it work? And what's the role of the call center? Typically, a physician determines the need for the device for the patient. They will then educate the patient and send the patient home with the device. The information from the device gets transmitted, and someone has to go in and monitor the information and verify it with the patient. There will be alerts coming up from the information. Now, many devices give a lot of alerts, and not all of them require physician intervention. So part of the work is to figure out which of the alerts are valid alerts and which ones require a physician to look into the patient for further evaluation. Now, let's talk about the role of the call center. First, the non-clinical staff. Call centers can provide a lot of help by reviewing the alerts regularly and decreasing the work on the clinical staff. They can also call patients back for device malfunction or education related to the device, because oftentimes a patient is calling because they have not put on the device properly. They can also refer alerts to a doctor based on rules that the doctor or the device manufacturer has given to the non-clinical staff. There's also a role for clinical nurse triage nurses to help patients. Triage nurses can use general symptom-based protocols, such as Dr. Schmidt and Dr. Thompson protocols, to just make sure that the patient is okay from an overall perspective, but then they're going to need specific disease and device protocols. These are important because they're going to help the nurse evaluate which of the alerts actually require a physician to take a look at. Generally, you want to use a nurse triage software to be able to triage patients and evaluate their symptoms and the alerts. A nurse triage software allows nurses to follow the protocols, ensure that they're asking the right questions and coming to the right disposition, but also to document all the calls in a very organized and standard way that can then be either attached or integrated to the EMR for the patient's record. Now, why is this such an important issue that we're resolving as a society? I want to take a few minutes to talk about my dad, whose picture is here on the screen. A few years ago, I went to visit my dad, who was complaining about a stomach ache and a little bit of a reflux-like symptoms. I worried about it, asked him that maybe he should talk to a doctor, and he did not worry. He felt that his brothers were visiting, they were eating out, and it wasn't anything serious as far as symptoms go. So he proceeded with his plans, traveled the next day, and when he got to the hotel, he had a massive heart attack and died within 5 minutes. Now, my father had diabetes and high blood pressure. He would have been someone who probably would have qualified for a remote patient monitoring because of the severity of his symptoms. Had he been monitored, the doctors might have picked up on some of his vitals that were not the way they have usually been, without depending on him calling the doctor's office and reporting. And had the doctors caught up on his symptoms and contacted him, he might have been alive today.